Okay, so we're kind of back. Yeah, that's right, we're back. So we're gonna do some two most common causes of hyperparathyroidism. So you have iatrogenic, you have autoimmune destruction. Cool. Rare causes. So what do you have here? Infiltrative. They don't give a crap. Okay. Cause hypocalcemia, low PTH. So magnesium. Oh yeah, I remember this. Mild hypothermia. It's always really hypercarbia. Well, I wish you did more. Okay. Hypocalcemia and elevated PTH, vitamin D. That's tumorilysis. What the hell are you doing? What is this? Rhabdomyolysis, blood transfusion, pancreatitis, chelate, critically ill, septic shock. Okay, so then what are two steps of management for hypothermia OR? So you just discontinue. I think it's anesthetic that caused it. Most likely Dantrolin. So the trampoline, bro. The trampoline guys. The deficiency, so we have decreased cutaneous synthesis. We have a decreased absorption, malabsorptive disorders, increased. Oh crap! Never mind. Okay, graft infection. Where's that? Graft. Okay, hanging from a graft. Oh, nice. Okay. Hypoglycemia by transfusion, most likely. So more common hepatic or renal failures. Okay, decreased ability to clear citrate. You can't clear that away, bro. CT surgery. So you have mediastinitis. What else? Flaming heart, endocarditis, and pericarditis syndrome. So you have IV calcium gluconate, and you have magnesium. Common source of fever following neurosurgery. So hypothalamic dysregulation, and also have meningitis. Hey, meningitis. Treatment for asymptomatic hypoglycemia, oral calcium. You also have vitamin D. DD, mother. DD. Hello, hello. There's no chat rate. Who has a chat rate of 1? There's no chat. Okay, so what is a common source of fever? So abscess. CKD related, say oral calcium, vitamin D. Otherwise, just give them the medication. What's wrong with this? So common source of fever following observing toxic shock syndrome from vaginal packing. Packing all that, okay. Hypoglycemia have an EKG, prolonged QT. Altered larynx. So it's sinusitis, okay. What suspect diagnosis warrant lab testing for patient post-op fever? So suspected infection. Okay. Clearing diagnosis workup for fever of unknown origin. So you have what is this? Urine analysis, sputum, cut arm. Oh yeah. Or we see I don't know how. Grenades. Okay. Red petri dish, skull and crossbones. Nice. This is a very nice way. A very nice way. Treatment of postoperative fever includes what two components? Treat underlying source, discontinuation of unnecessary IV or urine. Underlying source, discontinuation. What antibiotic can be used for symptomatic relief of post-op fever? So acetaminophen. Okay. What does degenerative cause in DMD? So you have skeletal and cardiac. Okay, so we have this one as well. Very nice. More than 5.5 is hyperkalemia. Hyperkalemia. The normal proliferation. So we have bleeding, okay, and hemolysis. And you have what is the cause of DMD or BMD? So deletion dystrophin gene. Oh yeah. So the body, so intracellular. Oh, inside. Okay, obviously. Come on. It's heart failure and everyone's favorite arrhythmia. Come on, bro. Come on. Beta blocker overdose, atropine, IV glucagon. Okay. And what patient? I can lead to what three conditions? So we have angina, acute diastolic heart failure, ACS, irritability, seizure. What? So hyponatremia. Okay. CKD is peripheral edema, dyspnea. Okay. So this is typically symmetric. It's usually symmetric. It's usually multiple. It's usually worse in the morning. Better. Okay, this I don't even need to. The Becker is better. Becker. Okay. It's through urine. Come on, we kind of notice. So aldosterone. Okay. Whatever. Inherited DMD, BMD. So X-linked recessive. Okay, more common in boys. What is the clinical presentation of hyperkalemia? So you have arrhythmia, you have neuromuscular weakness, and you have conduction blocks. Okay. When is the onset of DMD? What are the common initial symptoms? Weakness in the legs, pain in the legs. You also have clumsiness and falling. Okay, good. It's usually to maintain resting membrane potential across the cell membrane. Dude, come on. When is the onset of BMDs? 5 years of age, okay. So we have peak T waves, QRS. Didn't we notice? Oh no, actually we don't. No, we do not notice. Peak T wave, we have QRS interval widening. They don't mention much. What is the sine wave pattern? That's amazing. I would have never thought of that. Peak T wave, then you got your QRS interval widening, prolonged PT interval, P wave flattening, P wave loss, and then sine wave. Okay. What is the cause of pseudohyperkalemia? So you have hemolysis, hemolysis, and leukocytosis. I mean, that's gonna hurt. That is gonna hurt, bro. What the hell? The CMS. Okay, proximal weakness. What is a pseudohypertrophy? Thin arms. I mean, muscle wasting, contracture. Hyperflexia, or maybe even areflexia. Lordosis, kind of weird. Waddling gait. Tiptoe walk. That's not a tiptoe walk. This is tiptoe walk. And then you have floppy heart sac. There you go. Thank you for watching the video. How many minutes? 20 minutes. That's kind of cool. Pseudohyperkalemia. So recheck the potassium. Okay. And then what labs in DMD? So creatine kinase by 10 to 20 times early in disease elevated AST, ALT. Yeah, okay. Then what is transcellular shift cause of? So you have metabolic acidosis. You have, okay, what else? You have torn inside into the tissue breakdown. And then what is it? How is the definitive diagnosis DMD made? Genetic testing. What else you got? Muscle biopsy. Nice, okay. Leading to hyperkalemia, non-selective beta. Where's the beta? What else do you have? Some digoxin. What else do you have? Succinil. Okay. Limb girdle. No. What? 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 No way, dude. Not organic acidosis. Sorry, bro. Sorry. DMD. So you have genetic counselor. What else do you have? Cardiac workup. You also have around 4 year steroids. Okay, what else do you got? ACE inhibitor. You also got rehabilitative program. What else do you got? Novel therapy. A novel. Okay, I'm copying. It's vaccination. Nice. Let's see. So we have hemolysis. So we have increased K. Known crap. Okay, that's kind of weird. That's kind of weird. Okay. Let's go DMD. So dilated cardiomyopathy. What else you got? Arrhythmia. We got some heart failure. Twisted trunk, scoliosis. We kind of noticed. I may have cognitive and behavioral issues. How much is 5,000 seconds? I don't know. 5,000 seconds. That's kind of a lot. Actually, I don't know. Actually, let me actually search that. Let me search that, bro. 5,000 seconds in hours. Really? That's just that. That's it. That's it, huh? Whatever. Listen. Alright, so what are the renal causes? So we got oliguric AKI. We got some hypoaldosteronism. That's it. That's it. Really? Really? That's it? Chronic's DMD is kind of bad, right? It's kind of improved slightly between 3 to 6. 3 to 6, bro. Come on. Come on, bro. You lose ability to walk at 12. You can't lose... And then at 20, they can't even live. Oh, that kind of sucks. Oh, no. Okay. There's a decreased aldosterone production, there's a decreased renal. So you have diabetic nephropathy. Do you have any people here? Where's the people? Where the people at? No people? Alright. Alrighty. Okay. So we got diabetic nephropathy, and so it's calcineurin inhibitor. I know you like that. Calcineurin. Asmolol, EMS, and libido. Die in their 40s. Yeah, that sucks, bro. Calcineurin, tremors and AKI, hyperkalemia. Aortic dissection is less than 60 BPM. What is the cause of hyperkalemia? The decreased aldosterone production, independent of adrenal insufficiency. What is that? Nausea? Adrenal insufficiency. What else we got? ACE inhibitors. Nice. We got, what else we got? We got some heparin and LMHWs, bro. Some W's in the chat. So for lowering blood pressure. Oh my god. Nina, have a nice day. And I also have to use some nitroprusside. Aldosterone resistance. We got potassium sparing diuretics. Also TMP SMAX, bro. Come on. We love that shit. What does the management stand for? Type A aortic dissections. Emergent reopening and repair, bro. Come on. Just open it. Open that Open it, dude. Just open. Oh, IV calcium. What do you do for hyperkalemia? Give them IV calcium, some dextrose. What else we giving them? Beta blockers, beta 2 agonists. Oh, what is this? Some cation exchangers, loop diuretics, hemodialysis. Okay, that's kind of cool. All right, now AEIU we kind of know. Management for uncomplicated Stanford. Okay, medical therapy. Just give them the pill. Give the pill. Emergent treatment for hyperkalemia. Just give them symptomatic arrhythmias. K more than 6.5. Okay, what is complicated? Just give them. What is this? Thoracic endovascular aortic repair. I'm already yawning. That's kind of bad, bro. Patty Romer. Pat Keeper. Kyaxalate. Patty Romer. How does it work? Sun graft covers the tear, re-expands trillium. How side effects? Sodium polystyrene sulfonate. Bowel necrosis. Post-op management for following surgical treatment for aortic dissection. Let's see. So, we have chronic blood pressure control, serial surveillance, CT angiography. Nice. What should you suspect for high calcium levels? Malignancy. Okay. And then, the normocytic anemia. Marcellus, and what the hell is this? How do you get corrected? So it's just 1 gram, 0.8. All right. Is majority of the hyper is I thought it was like asymptomatic. No, bro, they're symptomatic, super symptomatic. Oh, okay, that's kind of weird. Name 5 signs of digoxin toxicity. So we're looking at like pile of bananas hyperkalemia. We got some lots of arrhythmia. We got some SA node. What else we got? GI side effects. Xanthopsia. It's amazing. Bradycardia, bro. Come on, bro. Come on. Okay. Anemia, pallor, and systolic murmur. I know you like it. It's for likely for asymptomatic, chronic. So acute, 130. Chronic is 120. I know you like that. Fatigue, nausea, and vomiting, and pruritus. Typically lasts for at least how long? Daily joint pain for lasts for how long? 1 hour. What? 1 hour? It's kind of weird. Okay. Now, symptoms of hypercalcemia, you have stones and bones. All for freaky, dude. What the hell is this? Bone pain? Nephrolithiasis, kidney stones. What is this? Nausea, vomiting, abdominal pain, a groan, polyuria. Oh, wow. What is it? Decreased deep tendon reflux. Is lapsed order patient for hypercalcemia. Repeat calcium, total plus ionized. I've been a PTH. Frick you, dude. Go for the PTH, bro. Come on. Pre-op imaging is required to screen for anatomical requirements prior to EVAR. So we're looking for the CT angiography. Normal, so we're looking for a primary hyperparathyroidism, familial hypocalciuria, hypocalcemia. And you got your favorite lithium. I know you want that lithium. Lithium, bro. Is EVAR. I know you like that EVAR. We can cause hypoglycemia with normal increased pH. So we have check the calcium clearance. No one gives a freak about you. Alright, so elderly, you give them the EVAR. For the young, you go for the AAA repair, bro. Just go for it. 24 hour. Order the 25 hydroxy vitamin D. I know you want it. There's an annual lead to follow. Okay. Decreased PDA. So you got your favorite. Everybody's favorite. What imaging modality for surveillance for AA after EVAR CT angiogram? Duplex ultrasound. Acute limb ischemia. Looking yellow wires. Okay, hypercalcemia. EVAR approach, aortic occlusion. Looking at yin yang, IVF, and antheroemboli. lytic bone disease, other malignancy symptoms, okay. Undergraft kinking and thrombosis of stent graft. Malignancy, okay. Hyperglycemic crisis, okay. For ischemic colitis following a surgical EVAR approach may be covered by undergraft or occluded by embolism. Jejunum, granuloma lymphoma, and vitamin D. So you have, oh, for frick's sake, what is this? Who's gonna remember this? Dude, we're not gonna do like this. What the hell? What are the two EVAR specific components that may present with endolink? Where is that? Okay, hypercalcemia, you have elevated 125. What else you got? Oh, for freaky sake. What is this? Intrinsic source, so granulomatous disease, lymphoma. I think the following dangers because there could be increased pressure. That is advanced enough to cause hypercalcemia. Chest radiographs, okay. And then later, after a surgical press, the graft infection, uroenteric fistula. Resorption, okay. Loma, venosus A, hyperthyroidism, and immobility. What are the two etiologies of bloody stool following a repair? How can they be differentiated? Other presentation, less than 30 days of aortoenteric fistula presentation. Okay, and then what is this? Less than 30 days. Milk alkali syndrome. It also has some thiazides. Nice, nice. When to treat immediately. What the hell? You go immediate, bro. How to treat severe hypercalcemia. Just go with it, bro. Go with it. Volume expansion. Calcium bisphosphonate. Dude, is this me or am I just not able to, like, concentrate? Volume expansion. This is getting out of my head. Alright. Wow. There is something wrong with me where it's like, dude, you just gotta go, bro. Expansion, and then you have like loop diuretics, then you have like donate symbols, then you have like calcitonin, and you have freaking hell, I don't know how many we got. It hasn't even been that much. We gotta go for like another 6 hours, probably. Here we go, seeing a patient with only mild symptoms, so no immediate treatment is required. Cause prevent strategies. Freaky sakey. Surgery. Nice. That's very nice. None. Okay. Am I just getting bored? You are kind of getting bored, bro. I just have to like read. Erythema, 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 bro. Carotid artery stenosis. Like this chronic digoxin have on the EKG, scooped concave ST segments. Over this IV naloxone, dude. With intoxication. I don't know what the relocation. Conjunctiva. Got the nail beds, you got the pumps. How long does hypertension have to be present for it to be considered chronic rather than acute? 2 days. Oh, that's it, huh? Okay. Severe uremia, encephalopathy. What is this? Motor neuropathy. That I can do. Pericarditis, platelets. Okay. Excuse me. Severe gastroenteritis. Worldwide. Rotavirus. I know you love that. Rota. Same systematic sclerosis, bro. Come on, bro. Come on. Let's go. I'm just getting kind of hot. I'm getting really kind of hot in there. Oh, whoa, wait 1 second, 1 second. Let me take my shirt off, bro. I gotta take my shirt off for this one. Okay, now rheumatoid arthritis that are often symptomatic. So we got proximal hands, we got the neck, and we got the spine. We got the spine, bro. We got the spine. So what form and how is the rotavirus vaccine given? Live attenuated, given orally, bro. It's a very live attenuated, bro. Come on. Okay, forgive me, bro. I'm talking about hemodynamic compromise, thrombus, emboli. Come on, bro. Come on. 2-dose series, Rotarix is 2 and 4 months. Rototech. No one gives two frickies, bro. No one gives two frickies. Oh, this can be compromised from carotid disease. We got like transient ischemic attack. We got some strokies. We got the strokies. We got some strokies. What is a rare side effect of the rotavirus vaccine? Disception. Ooh boy. Rotavirus, I know you like that. Rota. TIA did for base, but this dude's stenotic hyperperfusion was embolus. TIA from hyperperfusion. What is this? Really just a short recurrent episode. Meal from embolus. Single, and it's kind of prolonged. It really do be prolonged. So there's intussusception, there's anaphylaxis to latex, and there's SCID, okay. Okay, most fatal emboli. There's middle cerebral artery. There's ophthalmic artery. How many series is DTaP? When is it given? 5. Give 2 months. Okay. What? Hollenhurst. What is a freaking Hollenhurst, bro? That's like some off the shit. That's off the febrile seizures. What is this? Febrile? That's a DTaP, tap dancing. I'm tapping, bro. Come on. No, this for immersive fugax. Okay, what is it? What are we looking at? We're looking at what is this? Patching? Are we going to patch that? Vasodilators, paracentesis, ocular massage, contraindication red DTaP. History of being kept the body within 7 days. Prof prior disease. I don't know you anymore. What types of hemodynamic symptoms are not associated with carotid stenosis? We got vertigo, taxis, syncope. You won't have these. You just won't have these. Given 3 parts. Management is recommended for asymptomatic carotid bruit. Do not screen for that. Contraindication to the hip. The hibbies, history of anaphylaxis to latex. That is latex, bro. Come on, bro. Come on. Cause of TIA, what test must be ordered to first rule out other? So you got some non-con. What the hell? Non-contrast and a CT. Could be MR of eye. MR to the eye. Okay, kind of cool. And then imaging modality choice for working out this. We got your favorite duplex. Give the duplex. And then what groups are at increased risk of pneumococcal disease? We got some immunocompromised. Where's that? What else we got? We got the PPSV3. Can you hear me? I forgot what it called. What is it called? What? I forgot. Clap your... No, dude. Snap your fingers, bro. Well, that's kind of fucking gay. Like, what a fucking dork, this guy. Okay, management for symptomatic carotid. Less than 50% seen on duplex, serial annual duplex. Carotid ultrasounds, okay. For pneumococcal vaccination. Theory should begin for 8 weeks and after completing PCV 13 and 5 years later. 8 weeks after completing PCV 13. Okay. Again, 5 years later. Okay. What additional imaging should be ordered if carotid stenosis greater than 50% seen in duplex ultrasound? It's transcranial double. Where is that? Oh, kind of. I can see it. Contraindications of pneumococcal. Isn't it kind of weird? How am I going to deal with it? It is a weird thing. You're going to have to be someone in the U.S. Is there anyone here? We got to have someone, bro. Come on, bro. I don't know. It's going to be difficult, but you know what? I have to deal with it. You know, that is how it is. Wait, did someone do that to me? I don't remember, actually. I don't remember very clearly. Oh yeah, I just remember you. That's all I remember. That's all I remember, dude. It's a pneumococcal vaccine. Any diphtheria toxic containing vaccine. Okay, initial management for carotenosis is greater than 50% medical management. Okay, medical management. Okay, what is polio vaccine given? 4 series, okay. Stenosis, carotid endarterectomy. CEA, okay. The 2 steps of polio vaccine, okay. There's IM and oral OPV. Okay. Carotid endarterectomy is indicated for treatment of symptomatic carotid stenosis. What degree of stenosis? It's gotta be. Where's that man? Oh, there it is. It's kind of mentioned. They're not wrong. MMR vaccine. Type of vaccines. They're looking at live attenuated MMR. No one cares about the months. 70%. What management? Continue the medical. Just go with medical, bro. Come on. Gargoyle. I totally forgot about that. That's what it was called. Gargoyle? I've never used that word. Yeah, because no one ever sees it. But of them are given early. If you're traveling anywhere to an outbreak, yeah, that kind of makes it travel. Travel. Alright. For surgical treatment of carotid stenosis. Major disabling stroke. Completely occluded internal carotid. What are some contraindications with MMR vaccine? What are we looking at? Anaphylaxis, crossed out. Anaphil, immunodeficiency, did have that. Oh yeah, they did. Very nice, bro. I like that. Whew. Surgical canvas for endarterectomy, carotid artery stenting. Type and form of administration of VZV. Live, attenuated, administered subcutaneously at 12 to 50 months for 6 years. Okay. Second dose can be given earlier than the 4 years old. What surgical order of operation of carotid stenosis is bilateral? Operative, most stenosed side first. What? The VZV, Anaphil. We got Anaphil, immunodeficiency. IVG within 11 months. Okay. We'll screen for what other condition which can be sounded corrected in the OR. Coronary artery disease. Okay. What should be avoided with VZV? Salicylates. Okay. What protocol is followed to monitor the patient's neurologic function? Intraoperative EEG monitoring. Side effects of VZV. What are you looking at? Some varicose-like ravioli can cause varicose. That's what they meant to say. Can cause it. That's what I meant to say. Fatal complication which presents in 1 to 3% of patients. What is it? Major stroke? Or is it that you call that a stroke? Whatever, dude. When is Hep A vaccine given? So 12 to 24 months. Excuse my burping, but I gotta. For nerves which may be injured during carotid endarterectomy. So what are you looking at? Where's the vagus? That is vagus, yes. Good. Horses, yeah. By Horner and what is this? 12. Okay. So 12. Nice. So Vegas, we have hoarseness. I mean, we're just gonna have to assume hoarseness is some nerve. Hoarseness is symptomatic plexus. The last was partial tongue pretty. Do they have? Yeah, they do. And then Vegas. Yeah, that would be the one. Yeah, and kind of cool. Okay. For the influenza vaccine, so yeah, and quadrivalent vaccine choice for people with respiratory problems. Okay, live attenuated intranasal. Okay. And then name 2 non-neurostructures which may be compromised from carotid endarterectomy. Hematoma. Okay. What's the next name? What is that? Transient hypertension. Okay. And because of acute variant of anemia of chronic disease. We got that. You have that. That's it? That's all you have. Come on. Trauma. The lowers from the ulcers. I know one is diabetes. It has to be one has to be peripheral vascular disease. What's the other one? Ischemic, no, it didn't mention anything. What is this? Extremity, venous arterial. Could be neuropathy. That's it? That's all you'll go with. That's all you'll go with. It could be a venous, it could be arterial, it could be neuropathic. I didn't, you know what? Yeah. Yes, that makes sense. You know what? Yeah. Common pathogenesis of venous ulcers, valvular insufficiency. Yeah, okay. And then you have 6 risk factors for that. So what do you have? Female sex, you have obesity, um, advanced age, pregnancy. Yes, okay. Prolonged standing, yeah, your prolonged standing, and your DVT. Where's that? Whew. Yeah, that is gonna be a little difficult. Home location. Venous ulcer to develop above medial malleolus. And then what type of lower extremity ulcer is described as shallow, regular, covered, fibrinous exudate? Venous insufficiency ulcer. Okay. It's harder. I'm like, dangling heart. Well, you got AB music note, and we also have SA music note. Cholinergic toxicity. Yeah, but like, no, it would make sense if you had something better than diarrhea, urination, meiosis. I can't even remember. Diarrhea, urination, meiosis, muscle weakness. B for bradycardia, I'm assuming. What's another B for? Breathing problems, bronchospasm. E for emesis, L for lacrimation, and salivation, sweating. Lacrimation, salivation, and then sweating. Damn, bro, salivation and sweating. Yeah, I don't know how I'm gonna deal with that. Like it says, neurocytic or macrocytic. So you got MCV, 80 to 100. I mean, we kind of, yeah. Time to adjust. They have time to adjust. Okay. Non-traumatic fractures in people with CKD. What are we looking at? A non-traumatic, whatever that is. Okay, secondary. Well, they didn't give it right. So, okay. Patient with venous ulcer may present with what other chronic venous stasis changes on physical exam. So what we're looking at, hemosiderin. Well, this is a little difficult. Salami, stasis, stasis dermatitis. I don't know, salami. How did that turn into that? Okay, blue ribbon is varicose, obviously. Inverted champagne, that is lipodermatous sclerosis. Peripheral edema. What else we got? I think that should be it. Okay, cool. Well, list 2 non-joint related symptoms seen in rheumatoid arthritis, constitutional symptoms, and rheumatoid nodules throughout the body. Then, what is the presentation of lipodermatosclerosis? It constricts the ankle, inflamed itchy skin. And then, what imaging modalities used to work up venous ulcer? What are you looking for? So, we're looking at a duplex. Ultrasound examining for venous reflex. Treatment options for chronic venous insufficiency: exercise, leg elevation, and compression stockings. Venous ulcer. Vein ablation. Okay. What is a major risk factor for ischemic arterial ulcers? Peripheral artery disease. Alright. Well-defined, punched out necrotic. What, you're telling this one isn't? I don't know. Why would it not be? Arterial ischemic. Well, I mean, we kind of know it's toes, heels, malleus, shin. I mean, what else could toes, heel, shin? I mean, yeah, okay. Alright. It's severely painful. Why? Arterial is like severely painful. Sign of adrenal deficiency on physical exam. I don't know. Diminished pulses, is that what you're gonna find? Eczema is diminished. Oh, really? Okay. Gangrene, and also, what does skin change mean? Come on. Alright. Patient has arterial ulcers. What test should be used to work up? Yeah, you're right. That's a very good one. Neon, that's nice. Neuropathic ulcer, diabetes. It's by far. What? What do you mean? This is PAD, Clauto, charcoal. Did they mention it like that? What did they mention? That's peripheral. What is this? P80. What is this? Mouse hole. What is this? Charcoal. And what is this? Falling edge. BE81C's increased. And then where are three common locations for neuropathic ulcers to develop? Distal toe, lateral fifth metatarsal, plantar surface. What? Am I not talking? I'm sorry, guys. I got that whoa feeling. You know, just totally just went to another direction. I went on a different planet, dude. That's what I did. I went on a different train of thought. I can't pronounce thought right. Weird. What kind of a weird symbol is a poker? Monofilament testing, vibration, reflex plus. Basically, do any nerve exam. I used to work up neuropathic ulcers and PAD. ABI toe pressures. Makes sense. You got the neons. Dude. The neons. Okay, cool. Infected is you. Well, you'll have some warmth. A warm pie. That's nice. That's very nice. Okay. What is the approach to physically examining an ulcer? Probe the wound. Okay. Management for a non-infected ulcer of any etiology. Wound breathing accelerates wound healing. Management for an infected ulcer of any etiology. Blood cultures broad spectrum antibodies until culture results. Visible bone and ulcer. What? What is that? Visible bone. A ruler. That's not really good, but he's our. I mean, yeah. You know, yeah. He's our elevation. X-ray and MRI. Radionuclide scanning. Two-guide treatment options. Bone biopsy. Okay. What are three components of treatment for osteomyelitis? Empiric antibiotics. What else we got? Surgical resection. Mechanical offloading. Okay. Difference between spondylolysis and spondylolisthesis. Spondylolysis, of the pars interarticularis. Spondylolysis. What? What is this? I didn't think of this at all. Spondylolisthesis is just slippage relative to below. What the hell? No, it isn't. Well, then why is this totally broken? What? This is such a weird. What? Then why is one of them broken? One of them's like completely broken. I don't know, bro. Forced slippage of a vertebrae. I don't know, dude. What the hell? I don't know, how did that happen? So it's just one break. I can see that. Explain how inflammation can cause anemia. What's the most likely etiology of acute limb ischemia? Thrombosis. Okay. Causes scoliosis in children. Idiopathic. How is onset of acute limb ischemia in a patient with previous claudication different than in a healthy leg? Why? Fresh dark mud over old dirt clods. What the hell am I reading? Sometimes I wonder, what am I actually doing? Sometimes, yeah, it's gonna hurt. It needs to hurt. Prevalent scoliosis in males versus females. What the hell is this? Well, it's more in females. I don't know that. Cause of acute limb ischemia due to occlusion from thrombosis. So we have hypercoagulable state, that one. Bulging tire. We have that, and we have that. It's insane. You just cannot stay for not severe back pain, neuromuscular symptoms, breathing issues. Yeah, this is gonna be weird. Acute limb ischemia due to embolism from cardiac thrombus. It's so weird. Like, why does it go away? Like, is it not enough? Like, what do I need? Damn, like caffeine isn't good enough. Like, it just isn't good enough. This condition it's affecting. Damn, like, what do I need? We go back to the old days. Well, it's not like that. You can't have it like that all the time. I don't know, bro. I really don't know. I haven't been a part of anything. AFib, valvular disease, am I? For a patient with scoliosis. Looking for the arm to height ratio? Oh, nice. That's always necessary. What is this? Alright. Brain, neurofibromatosis, examination, leg length discrepancy. Nice. There's atherin, there's thromboemboli. That's kind of cute. What can be used to assess for future curve progression in adolescents? Really, Tanner staging. There's a Tanner staging for the curves. Interesting. Relative size of atheroemboli and thromboemboli. Atheroemboli is kind of small, bro. Kind of small. The thrombo is kind of large. It's a larger one. I don't know, bro. I don't even know what's even going on. Yeah, I don't even know what's going on. Hypokalemia. I mean, this is kind of the life I ever wanted. Like, what do you want? I don't know. That's... I don't know. Yeah, it's weird. I got something like that, huh? I don't know. CKD. AKI. Crack post sign. Diabetes. Crap, sure. Where's the crowd? Yeah, we got it. Glomerulonephritis, nice. Yeah, it's a lot. It's a lot to take in. That's what angle defines scoliosis? What? What? A cob angle? Where's the cob? Corn cob. No, it's not cob corn. Excuse me, bro. More than 10? Alright. Dislodgement of atheromboli, thromboemboli. Dislodgement. AAA, catheterization procedures. What is interstitial lung disease? Pericarditis, myelitis, and then scleritis. Scoliosis treatment. What? Just search. I don't know. Mild. Just back brace. Back brace. Surgery if it's more than 50. Oh, I didn't know that. Well, I wish they had like something with it. I don't fucking know, dude. I don't really know. I don't know. Symptoms caused by occlusion from atheroemboli. So you got blue toe. Yeah. Trash foot. Nice. That was nice. Scoliosis. Scoli, bro. Restrictive lung disease and corpulmonal. Nice. Yeah, that was nice. That was kind of cool. Very nice, dude. Very nice. How can you have a scoliosis of 90 to 100 degrees? I don't want to know. What physical exam finding can help confirm the etiology of blue toe? I don't know, bro. Palpable pedal pulses? Okay. Most common cause of kyphos scoli abscess is idiopathic. Well, then why are you showing showers? Whatever, dude. Whatever, bro. Kyphosis. Showerman kyphosis. Oh, showerman kyphosis is idiopathic. Okay. Okay, bro. Okay. The most common location of occlusion from a thromboemboli. Femoral artery bifurcation. Most like etiology of sudden limb ischemia. Embolism, okay. Does improve when lying, okay. Ice pack, then there's paresthesia, and there's paralysis. How does a leg mean paralysis? Pallor. Pulselessness. Oh yeah, you know what? Yeah, this is important. This is important, dude. This is like, yeah. Implosion with kyphosis. What else is hamstring tightness? I know the caffeine has run off, but like, bro. Baby, tell me, how did you get so cold enough to break my bones? It feels just like you don't want me anymore. I don't understand why. I don't know, there's just a lot going. It could disrupt you, but yeah, I don't know, bro. Yeah, you don't really have to do that much. What else do I have? This is like the only thing I have. Yeah. I wonder though, if there is a way. It's a weird one. It's a really weird one. Obviously, I know I'm being played. How? You think you lose hope, but in reality, there's actually a lot of things you can do. And I still have time. One thing's like for certain, you're not gonna live a normal life. Not like this. I'm too messed up. And also just like it's just over. A little more. I have such a golden opportunity to not care, and then Well, I care. It's not gonna make it better. Even when I care, I mean, you're not. Even you never were, and that's something no one can understand. Nah, he understands. He just doesn't care. Yeah, I don't know. I don't know. My mind is going haywire. My mind is like that. It's so weird. Food could help, but like, come on, how much can you really, really like? Come on, it's like 4,600. Like you cannot stop. Yeah, you can just keep doing it. Just order something, and like, yeah, just do something. Yeah. Baby, tell me, how did you get so cold enough to chill my bones? It feels like I don't know you anymore. Harder like a nation, cold enough to see my. I don't even get any views. I don't even know. I don't know, but like all I know is some things you just can't get. Some things you just can't get. Like I mean, some things you just can't get. I mean, it is what it is. Balanced life, that's not gonna happen. That's just not gonna happen. What does that mean? Like, I'm already in such a weird position. It's like the weirdest position I could ever be in. What? Like, I've taken so much. Like, it's kind of weird. I can, maybe, you know what? They're probably right. You probably should do something. But it's like so weird. I mean, I'm not doing well in certain things. I do have a mind. So weird. I can't take anything from them. This is like, even when you're with someone, you're not. That is like, I gotta get out of here. Gotta get out of here quickly. Thank God it's only like another year. So, because I mean, I don't know. Let's hope I never come back. Let's hope, dude, because this shit is. I just want to go somewhere else. It's not. I don't even want to talk to some of these people. It would be good. It's probably a good way to, not engage with these guys. Because it's kind of like the Kill Bill scene. Just, like, it just hits back to you, all of that. So, yeah. It'll be a good thing to get out of the city, get out of this place. But, yeah, we're gonna have to see how that lasts. This is kind of weird. I didn't know this. It was like this. I should go back to study. I really should. Yeah, you need another dose? Yeah, you need another, like, dose, because I don't know how bad this could get. I knew I had some problems, but damn, I didn't know it was gonna be like that. I didn't know it was gonna be like that. coffee, but you gotta eat something. I mean, that's a weird thing. Very weird. You should probably eat something. It's not really like that. I mean, I'm just blank. I don't even know what I want to do. This is scary. No, I'm not. I can't. I gotta do this another 6 hours, bro. You got another. You know what we can do? We can just maybe look at the phone and then buy something. Cause I can't. This is getting out of hand. It's getting out of hand. It really do be like that. There's 3 messages? For what? Alrighty. Well, let's see what the guys did. Listen, you got what you wanted. Yeah, it seemed like a good thing, you know? I wonder what my problem is. You know, I can't get this melody. This is so it's so basic. It's so old. It's such a like what is wrong with my mind for me to like I need like some electronic. I don't know. Yeah. Wow. I try to listen to some of these. I crave the electronic. Yeah. So yeah, it's such a cool song. Yeah, it seemed like a cool place to be. It's kind of cool. Hey, Shiva win too. That's kind of cool. Oh, come on, bro. Come on, bro. Come on, bro. Well, you got up close. Damn, how did you get up close? That was like cool. Yeah. Yeah, nah, look, listen, it was cool. Yeah, it looked cool. What is this? Well, you got a hot looking girl, but like, whatever. Yeah, well, at least you got a few more stuff. Oh, let me guess, that's you. Who's in here? Really, I so thought that was gonna be you. Something wrong? Okay, huh. Okay then. Hmm. I keep forgetting. Hmm. Interesting. Dude, I only have like another 5.5 hours. Man, let's come back. Fuck, dude. Like, how much caffeine do I need to stay focused? I don't get it. Like, it seems like a lot. It's like, it's not enough. I need like a big meal. Maybe a big meal would help. But like, that's not gonna help. I don't know, bro. I don't know. I think it also hurts because I didn't eat anything. Like, let's buy something from my yard. Because I don't know. I feel bad. I feel bad. I need to fight for everything. That's what I need. I need to fight for everything. I'm just a weird guy. That's all I am. Just a weird looking guy. I gotta make a point about everything. I do be like that sometimes. हेलो हाँ दादा मैंने एक ऑर्डर डाला था चेक कीजिए ना व्हाट्सएप में चेक कीजिए ना एक बार ठीक है okay cool that's kind of cool I don't know what to do with you guys dude I mean my mind is such a maze The fuck is this? Oh no, yeah. Bro, my mind works like a freaking. It is so weird. I don't know what to do. Yeah, you feel tired, don't you? That is weird, bro. That is so weird. Like a jog away,